Healthy You, brought to you by UNFPA.
The saying time flies when you're having fun is also true when you're learning. 12 episodes of Healthy You have gone by, and we hope you've enjoyed this season as much as we have enjoyed giving it to you. In this week's hour-long special, we'll go through our topics again, answer questions, and address concerns you had this season. I'm Amashika, coming to you from the beautiful Sunset Beach Resort and Spa here in Montego Bay. So strap in, because the final episode of Season 1 of Healthy You starts right now. Your health must be your first priority. Many lifestyle choices can affect your risk for developing diseases. So, if you are what you eat, then eat right, and that will lower the risk of developing diseases such as heart disease, cancer, and stroke.
My dad was a good provider. He provided stocks. When Daddy buy, it was cases. So the house was like a warehouse. Everything you wanted was there. So when Mommy, especially on a Sunday, she would do like light, liver, ackee and saltfish, tomatoes, plantain, pear, breadfruit, breads, everything sliced up. So, you know, like a Walt Disney show, you know, that spread, that was it. In the week, same way, she cooked rice. Daddy loved plantains, so she do plantains, pear, two meats. She do chicken, she do mutton, she do oxtail, she do pork with it. You know, it was just like that. So, until you get your food, you get two meats. So, just imagine that. You just constantly, and I don't like vegetables. Rice and meat is me. So I consume that. But as a young lad, didn't see the weight coming on, you know? Because I ride, I play football, did a lot of things, keep myself active. Every week we play football. When I start putting on the weight, I myself really didn't see it because clothes still fitting, still feel healthy in thy body. And as much as people say, you get big, you know, I'm like, no. I had gallstones. So, you know, that is surgery. And I went in, after days in the hospital, they took out my gallbladder and they took my appendix as well. But the doctor warned me, he said, now that you don't have a gallbladder, whatever you eat is going to go straight in your system. And I came out and just start eating. When I leave here or whatever and go anywhere else with food, that monster step out. I need that. I don't want it to know. When the monster is saying I need it. At the end of the day, I'm digging my own grave then with a spoon. You understand me? Because I'm saying, if I drink and eat, it's not going to affect me, but it does. And there's time when I look in the mirror and I'm saying, Jesus, who is this? Because I'm really overweight. I need a drill sergeant. I've put on this luggage, and Jesus, I can't carry it no further.
Hi, I'm Dr. Joy Calendar, a nutritionist. This evening we're in the supermarket and we're going to spend some time talking about how we can use the foods that we choose when we shop to help us with the problem of obesity. This is where we find much of our vegetables and our fruit, and we want to spend a significant amount of time in our shopping right here. We want to choose our vegetables with lots of color, so things like tomatoes, carrots, cucumbers, grapes. Let's not forget our dark green leafy vegetables, good for things like cancer. Apples and grapes, a good source of soluble fiber, good for our cholesterol. These are some of the things that we want to be paying close attention to. Many of us drink our calories in addition to eating them. This is what we call a nutrition facts label. We want to pay close attention to the serving size. When we look at the number of calories and we say 120 calories, many of us make the mistake of thinking that there are 120 calories in this bottle. But this bottle has 16 ounces. So you see when it says servings per container 2, when you drink the whole bottle, you haven't had 120 calories. You've actually had 240 calories. If you have 100 extra calories every day for a year, you will have gained 10 pounds in a year. An example of the supermarket that you want to avoid, spend very little time, the processed white flour, high sodium snack items. Very little time. Now this is one section of the supermarket that you could spend quite a bit of time because there are so many brands. But there are some things you want to look for. Look not just at the nutrition facts label, but look at the ingredients. You want to look at whole wheat or whole grain corn. You want to look for fiber. You want something that's low in calories. And you want something with some protein. The fiber helps to keep you full, so does the protein. So look at both labels, both the nutrition facts and the ingredients labels. Now here's another section of the supermarket, breads. What an array. Don't bother to pay too much attention to the color. Let's look at the label. We want a whole grain bread. What does that mean? Look at the ingredients label. First ingredient must say whole wheat bread. End of story.
Food is important. Healthy food even more so, since being obese is a major risk factor for many chronic diseases, including diabetes.
Diabetes affects up to 1 in every 5 Jamaicans over the age of 15 years. It affects Jamaican women more than men, and the women tend to have it worse than the men. What is even more troubling is that there are many persons who have diabetes and do not know it, and many who know they have the disease, but it is not under control, either because their medication is inadequate or because they do not take any medication at all. Because of this, many persons with diabetes suffer from various problems associated with the disease. Topping the list is your risk for heart disease, which can lead to a heart attack. You can also get a stroke, which can either result in death or permanent disability, which will dramatically change how you live your life. There are other serious problems like kidney disease, which in its most severe form can cause you to end up on dialysis. It can also cause eye disease, which can lead to blindness. And men, listen up. If you find your sexual performance is less than desirable, diabetes causes poor sexual performance too. So if you have diabetes, see your doctor to ensure it is under control. And if you're not sure if you do have the disease, see your doctor to find out if you do.
Healthy You will be back after a quick break. But before we go, take a look at this Healthy You fact.
Don't skip breakfast. Studies show that eating a proper breakfast is one of the most positive things you can do if you're trying to lose weight. Breakfast skippers tend to gain weight.
Welcome back to Healthy You. This is our last lap for season 1. Now, sex is a very big deal, so this season, many of our themes were related to our sexual health, since every day, young people face situations where they must make choices that can impact their future.
No, this does not mean you cannot get pregnant. What most persons don't know is that getting pregnant is not as easy as you think. Actually, only 30% of sexual encounters result in a pregnancy. The timing of your sexual activity is also important, as women are only fertile for about 7 to 10 days out of the entire month. And sometimes when you do get pregnant, you may not even know it because you have had a miscarriage and thought it was your period. That being said, it is possible that there may be a problem between you or your partner with getting pregnant. The factors to consider include your age, how often you have sex, and whether you have any untreated sexually transmitted infections that could lead to a problem like this. Another important aspect has to do with your partner. Have you had the same sexual partner over this time period? Does your partner have any children of his own? You see, 30% of the times you are unable to get pregnant, the problem is with the man. You will need to see your doctor, who will find out this information from you to determine if there is a problem. Even if your doctor does find a problem with either you or your partner, this does not mean you will never get pregnant. Your doctor will work with the both of you to try to find the solution to allow you to experience the wonderful joys of pregnancy and parenthood.
Well, I grew up with my mom, my uncle, my brother. It's a small family. Father wasn't around. I was 16 years old when I started having sex, which was a big regret because I got pregnant. When I found out I was pregnant, it was terrifying. When my mom found out that I was pregnant, she called the phone and said, "Listen, when you see me, don't like you to see me. Walk on the next side of the road." And that was when I broke down and started crying, my own mother rejecting me. Well, getting pregnant in high school is definitely not the way, and was not the way. I got recommended for CXC subjects, couldn't get to do them because I had a kidney failure on my way to the first exam, and that just hindered me from doing them. However, I got treatment, yeah, and thing recover and whatever. Still never get to do the CXC them. After having Tariq and thing, my main focus was just on the child, not going back to school to get a education.
Yeah, I know, right? And what else? Master of Finding what?
I am telling all you teenagers, stay away from sex. Yes, stay away from sex, because being a teenage mom is not the way. I am a victim, and it was very rough, very, very rough. Taking care of a man, taking care of a child, working, not easy. It was very hard. Didn't enjoy my 17, 18, 19, 20 years, none at all. It was just all focused on my child and his father and going to work and all of that. Lost all of my friends. It was just me and the little family.
I think we're always talking to children about sex and sexuality, even when we tell them not to talk about it. So if we tell a child not to touch themselves, not to say those words, not to do those things, we are actually telling them about sex. And what we're saying is sex is something that's taboo, it's something hidden, and it's something that you are not supposed to be interested in. I think one of the first things that parents need to do is that they need to get information for themselves. Go and read up on some of the things that you want to communicate. What is it you want to tell this young person? And it's important as well to do that throughout the child's life. One of the things that parents fear is that if they tell their children about sex, then the children will go off and have sex too early. That's because the parent is fearing that if I tell my child about intercourse. If the parent were thinking about the broader topic of sex and sexuality, they would tell the children more. Research shows that parents who give young people information early and give them good factual information help them to delay sexual intercourse.
Though the subject of teen sex scares parents of teenagers, it's understandable. Just keep the lines of communication open. It will help them to protect themselves from sexually transmitted infections, HIV, AIDS, and unplanned pregnancy.
Jamaica has made wonderful strides in terms of the prevention of mother-to-child transmission. It's also done really well in getting a large number of people on treatment. But what we do find is that the number of people with AIDS who are dying is still pretty high, which means either adherence is not good enough or people are not taking medication the way they can, maybe because it's not available, we need to look at why. I know earlier when HIV meant death in a few years, it was a different situation. Now with access to treatment, people with HIV can live for 20, 30 years, and that's the same as what one would live with if one had cancer, one had diabetes, one has a heart condition. So there are many conditions which one has, and we never know when we are going to die. So to deny somebody a basic right, which is essential to the continuity of the human species, because you have a certain illness, is not something that I think is right. One of the big barriers I see is the high levels of sexual violence. We do find that there are reports of rape, incest, different kinds of violence which include sexual acts and coercion, or in a way transactional sex, where the only way you can continue to live or continue to go to school or continue to work where you want to is by trading sex for it. And in these acts, often the young woman concerned has no agency or no ability to ask the man to use a condom, and doesn't have any form of protection herself. We also know that when it is coerced or forced sex, the danger of transmission of virus is more.
Every 24 hours, an estimated 7,000 people are infected with HIV, and more than 1 million contract a sexually transmitted infection. To date, around 65 million people have been infected with HIV, and AIDS has killed more than 25 million people since it was first recognized in 1981.
I was a housewife. Wasn't promiscuous or anything. Didn't have to work. Stay home, get everything. Stay home with the kids, the step kids. I didn't have to practice safe sex with my husband because I wasn't going anywhere. I wasn't doing anything. It wasn't in my thought any at all. What really prompted me to go and get tested, it was when my last son was born. Was born sick, stayed sick a couple of months. In and out of children who came up here, they decided to do some tests, and getting the result from the test, we know about the HIV. Tell them about children, tell them wrong. Moving from children, I did another private testing. They are saying the same thing. I may do another one, which is 3, and then saying the same thing. It may end up go back to children. Children asked me to go and get tested to make sure. I did, and it says the same thing. Just like my son refused to believe. So I'm go and do another private testing, and he says the same thing. I go home, I'm confront him and say them wrong. So I say, all right, 5 places wrong, 5 different places wrong. I go to film doctor. Film doctor do the test. Film doctor went trust, do the test. He say doctor wrong. We go to a different place, do the test again. All 3 away. Test saying the same thing. The only thing he said, John no star why me. After the doctor confirmed, and we sit down to talk about it, he said I must me go outside. So I have other kids before the baby. I never really have the intention to kill him and go over, so I say no, I'll leave this man alone. How soon did my husband pass away after finding out his status was like 5 years? Because he was still in denial, wasn't taking anything, wasn't seeing any doctor or anything. So you get pneumonia, go to the hospital. Then, you know what, I would say to those persons who believe that this can never happen to them, never say never, because I've been there and I've said that already. And this is where I am now. You can't see somebody and trust them just like that. Yet, as well as you can't see somebody and know that that person is HIV or not. So the best thing is to do to be safe. My message to people out there who stigmatize is don't do it. Because you see somebody you can't tell by looking. They might fat, look good, skin clean, everything. You can't tell by looking. The greatest thing is to know. I know my status. Do you know yours?
HIV means human immunodeficiency virus. Like other sexually transmitted infections, one of the ways HIV is passed on is during sexual contact by the exchange of body fluids. The most common method of sexual transmission is through penetrating sexual intercourse, whether vaginal or anal. HIV can also coexist with other sexually transmitted infections, such as HPV, the human papillomavirus. When this is the case, it can actually increase a woman's likelihood of developing cervical cancer, the #1 cause of cancer in women between 15 and 44 years old. So what can you do to protect yourself from getting HIV or any other sexually transmitted infection for that matter? The most dependable way is to abstain from sexual intercourse. This advice is especially for you teenagers. At this time of your life, you should concentrate on studying hard, getting good grades, getting involved in sports and other extracurricular activities, and thinking about your career for the future. For the adults who are sexually active, please be honest and fair with your partner. Ensure you only have one sexual partner. Also, use a condom every time. It will offer good protection, but remember, it will not give you 100% protection. This means that if you are not in a committed relationship, you too should abstain from sexual intercourse. One more thing, know your HIV status. If you haven't done an HIV test as yet, now is the time to get tested.
It's time for another break on Healthy You. Stay tuned.
Always practice safe sex. Using condoms not only avoid the spread of HIV, but also to protect both you and your partner against other sexually transmitted infections.
Hi, welcome back to Healthy You. I'm still here at the Sunset Beach Resort and Spa in Montego Bay. This season we dealt with physical illnesses, and we all know that a healthy mind is just as important as a healthy body, even if you're not happy with it.
Plastic surgery, an old surgical discipline. This is an area of surgery that is concerned with the restoration of function and form of the human body. Plastic surgery has two concerns. There are the general and specific complications that go with the usual surgical procedures, and we have a second subgroup that you may call the likelihood of a dissatisfied patient, which may be more a sequelae rather than a complication. Therefore, it is most important that at the preoperative consultation, the pros and cons of the procedure is looked at. In terms of requests for cosmetic procedures, almost like North America, the most popular request, I think, would be maybe a tie between liposuction and breast enhancement. Then we have closely following up rejuvenation of the abdomen, particularly following pregnancy, and you have rejuvenation of the face. Plastic surgery has made a dramatic impact on the population, right? Basically because it's intended to restore not only form, but quite often function. So there's no doubt that there is a definite role. If a patient has been distorted, for example, by the ravages of pregnancy, and we have seen young patients, early 20s, they have one child, and it has almost totally wrecked their abdomen. And the psychosocial impact that this has, probably is immeasurable because he may not even perform well at work. So, you know, it has serious impact. And properly thought out restoration or rejuvenation of that body form can make a dramatic impact. Patients who have enlarged breasts, for example, are sometimes transformed because they really have serious issues from adolescence going through, which is almost unfair for those who are more privileged with, you know, a more acceptable size. So there's no doubt that it can change the image for the better.
My name is Latoya Jackson, and I'm an artist, recording artist. Growing up as a teenager, yes, something was wrong with my appearance. I struggled with acne, and in school they usually tease me and call me Bumpy Killer and that I was a nerd and all sorts of things, but you know, we live over that, thank God. Yeah. I had problem with my body, that's why I wanted to do implants, and yes, I did research. I went to my dermatologist and she referred me to Dr. Ascott. So, you know, went and did the consultation with Dr. Ascott, and you know, in my mind, I just had that Pamela Anderson. I said, yo, you know what? I'm a fan of her, and yes, I want to look like her. And trust me, you know, all through my thing, going there and thing, I still had doubts in my mind, like, what are people gonna say? What the outcome is gonna be, or what, you know, just what. But at the same time, I say, you know, I'm doing it for me. I don't care what people wanna say. I have the problem with my body, with myself. I need to have confidence about me, about Toya here, not about people, right? The surgery lasted about an hour and a half, so, you know, and then when it finished and I went in the room, I feel something just like jiggle in my breast. I'm like, ah, what is that? Can't wait till the bandage come off. And finally, when the bandage is removed, I was like, okay, I felt so good about myself. I'm like, yes, I finally look like a woman now, not this little boy-shaped girl with no breasts. This is saline, you know, this is not the implant, you know. My spouse loved it to the max, you know. He was saying that, oh, Doc did a great job. You know, he had second thoughts in his mind, like, wonder if it's not gonna come out good, you know, this and that and ray. But when he saw the finishing look, he was so proud about it. The advice that I give to young ladies out there who want to enhance their confidence and their look. Take me for an example. I was teased on at school, nobody really know that, but trust me, it was hard for me going to high school, growing up as a teenager, you know. I got called on picked on by boys, girls, that you look like a boy, you this, you that, and you know, I cried nights upon nights, and I finally put into myself and say, you know what, I'm gonna do this for me. I'm gonna let Toya feel good. You know, I don't care what anybody wants to say, I'm gonna do it for me. If you wanna do it for you, do it for yourself. Have confidence in yourself and go and get it done. But do it for the right reason and do your proper research.
More on Healthy You on the other side of this break.
Some people's emotions have a really big effect on how they think they look. People who are extremely self-critical sometimes think that changing their looks will solve their problems, but there are times when it goes deeper.
Depression is a disorder, a disease, and a symptom complex all at the same time. By that I mean you have to have various criteria to satisfy the definition or diagnosis of depression. First of all, what we call psychomotor retardation. Brain and body literally slow down. You have also problems with appetite. Sometimes people undereat. Sometimes depressed people overeat. Then you also have problems with thinking, usually slow thinking and mood disorder. The depressed affect or mood means that there is a low feeling tone, and then there's the whole business of the fact that the things you used to enjoy, you just don't enjoy them anymore. There is what we call seasonal affective disorder, which is sometimes seen in wintertime in colder climates. There is also reactive depression, which is an extreme response to circumstances that would make people sad anyway. And then there are the depressive episodes which might fall under unipolar or bipolar, meaning mood swings with either highs or lows, or sometimes both. Well, the most common cause of depression is being born with a tendency towards depression. The most common cause of depression is a genetic predisposition to it, which comes down in families. The next common cause has to do with one's inability to cope with one's circumstances. The next common cause of depression, believe it or not, is relationships and relationship problems.
Depression is more common than AIDS, cancer, and diabetes combined. But even though it's a common and serious problem, many people consider it a weakness and not an illness. It is also hard to tell who is at risk, why, and when they're most likely to be vulnerable.
I am a Christian, and I was an active member of a particular church where I served in many capacities: youth choir, senior choir. I was one of the directors of the children's choir, and I got involved in a relationship that wasn't seemingly correct for the church. The person wasn't a Christian, and I got pregnant. However, I knew that in my circle, apart from my relative, I would not be accepted. And I went ahead and I did an abortion. After the abortion, I just couldn't live with myself. I felt as if I was a murderer. I felt as if I just wanted back my baby. I went to a doctor because I was getting very depressed, and I was telling him what was happening in my life, and he prescribed some medication, some antidepressants and some sleeping tablets because I wasn't sleeping at all. And after speaking with her, I guess she figured that I'm at risk, so she asked my roommate to keep the tablets. My roommate, she was keeping them, but I just felt as if, look here, it doesn't matter what you guys try, I just want this over and done with. So I waited until my friend went to church, and I went in her room and I collected the tablets. And in the night, I took them. I took in all maybe about over 10 tablets. And the next thing, like I was going in and out of it, consciousness, and I remember hearing my relative coming in the room, and I remember the relative who lifted me up, but I remember nothing else from that. As a child, I was molested, and this is something that I struggled with for years. Sometimes I really feel as if I would kill myself. Alright, I have a new outlook on life. I surround myself with persons who I know that will encourage me. I keep away from persons who are very negative. If I realize that you are not somebody who impacts me positively, I don't incorporate you to my circle. I have a husband and a child, and I feel as if I have somebody to live for. And if I do feel depressed, I know what to do. I speak about it. I don't keep it inside and cause it to gather. I speak about my feelings.
We all have bad days when we just want to go home, get comfy in our pajamas, and indulge in guilty pleasures. You know, maybe a glass of wine or two, or the entire carton of ice cream. But what happens when we crave this feel-good feeling all the time?
An addict starts participating in certain activities to include the use of substances. That's free will. That's your choice if you accept and start using a substance. It starts with being exposed to the substance, and then you experiment. Once you start using, then the substance produces an influx of a specific neurotransmitter called dopamine in a specific area of the brain, called the nucleus accumbens, which leads to a feeling of elation. There are other natural things that we all have, we're born with, that lead to that same feeling of elation. And these include hunger, thirst, sex, maternal instinct, and sleep. So what happens with an addict is that they now become familiar with an activity or a substance that leads to this feeling of elation immediately. And so you're no longer interested in eating, you're no longer interested in sexual activity, except of course to get the funds to buy the substances. By then, you're no longer interested in caring for your children, you're no longer interested in sleep. In fact, in the case of cocaine, for example, it's a stimulant, so you're not sleeping, you're using and up the whole night. Ultimately, what happens is that the use of the substance becomes your main priority. You then start being late for work, you're using all night, you start being a little smelly because you're not bathing as you're supposed to. You've been using all night, it's now time for work, you can't get to go home, to go to change your clothing, so you start looking a little scruffy, and then the behavioral changes start to come in. Your main focus is to leave your place of work or home to go and seek the substance. Nothing else is important. And so individuals start recognizing that something is going on, something is wrong. Differs for different people how long it takes to get to this, but what's clear is there's a spectrum from my choice to use and moving along a spectrum to a genuine medical illness, which is a brain disease called addiction.
Well, Mitchell, alias Indian. I'm addicted on crack cocaine for about 20 years. And how I get started using the crack cocaine, I have a good friend who works amongst tourists and the Matabere. He involved in crack cocaine smoking, and he have his relatives who try to encourage him to not to smoke. So he called me and showed me where it said and said go and buy it for him. So when I buy it for him now and give him it, I stand up, watch him smoking it. And he turned to me and said, you want to taste? And me say, yes, I want to taste what it is. From the one taste I make, I started to buy it before. And I never smoke marijuana or ganja before, no time at all. I get hooked and get all out, started to smoke day and night, 7 days a week, get neglected by my family. But the person in himself, conscious, is just because he hooked on the crack cocaine and he don't have any control of him doing. Each time he gets some money, he buy it, he will sell him soap, if you give him a pair, if you buy him a food, he will sell it just to buy the crack cocaine. But I reached to a situation now where I go to the rehabilitation center, Salvation Army Rehabilitation Center. When I go to that rehab, I graduated. I finished my program and graduated, and reunite back with my family and go home. When I go home now, my relatives, them never really educated towards how to deal with a person who just come off drugs. Each time, like one of my little sister would say, cokehead boy, and you're born coke and up on the street and style like that. So those type of things, it get to you and it causes you to relapse. My mother lived into an area which is Walton Park Road area. And since I relapsed and start smoke by crack cocaine, living on the street, she moved from that area and live in Portmore now. She and all my sisters and my daughter and so forth live in Portmore now. I don't know where in Portmore them live. Once when I just started smoking cocaine, I love the feelings, what it gives me. And I love how it tastes. And now I do not love how it tastes. I don't love the feelings anymore. But what caused me to relapse more time, me smoke 1 time or 2 times per month. When I sit by myself and think for 15 years you don't see a mother. It caused it to relapse. That bird.
You've asked a very interesting question and very relevant too, considering that in 2002 it was reported in a population-based lifestyle survey that nearly half of Jamaicans felt down or depressed. There aren't many studies done in Jamaica on depression and drug addiction. However, reputable studies done in the United States indicate that between 20 and 50% of persons who started drug use did so to deal with feelings of depression. Other studies, however, show that depression is a very common factor in drug addiction, so that a large percentage of persons who either are addicted to alcohol or illicit drugs were depressed. As to which comes first, the depression or the addiction may be debatable. What is a known fact, though, is that depression and addiction often exist together. How do you know if you are depressed? Well, if you find that you feel sad almost every day for most of the day, if you find that you're losing interest in doing activities you usually enjoy, or find yourself being very irritable, withdrawn, or feeling helpless or hopeless for whatever reason, you are depressed and you should see your doctor for advice and for help. Do not turn to drugs. If you are a person who gambles, drinks alcohol or uses marijuana to the point where you cannot adequately look after the needs of your family, if your bad habit causes constant conflicts and fights with your spouse, or prevents you from performing well at work, you have an addiction. You may have started this bad habit to deal with feeling depressed, but the environment your habit is creating for you will definitely lead to depression. If you think you are addicted to a substance or habit, see your doctor. Get help today.
Stay tuned. More Healthy You coming from the beautiful Sunset Beach Resort and Spa in Montego Bay.
If you need help, don't be afraid to ask for assistance. It's a sign of strength to ask for assistance, and people will respect you for it.
Welcome back to Healthy You. The big C often feels like a death sentence to those being diagnosed with cancer. And although it's a worldwide killer, this season on Healthy You we dealt with 2 that are preventable: cervical and prostate cancer.
Cervical cancer is a common cancer of the uterine cervix. And the uterine cervix is that portion of the uterus which is at the top of the vagina and can be actually seen at examination. The rest of the uterus is inside the abdomen and is not seen at a regular examination. It is the most common female cancer after breast cancer. The risk factors for cancer, the cervix, really there is one main risk, and that is the cervix being infected with a human papillomavirus, which is a common virus, but some types are what we call high risk and some types are low risk, like those that cause warts on the skin. People, however, associate this HPV infection with certain behavioral patterns, such as early age of first intercourse, multiple partners, and even if you do not have multiple partners, but partner that has been infected with the virus that causes the condition. So a single partner who has had multiple partners can be as bad as somebody who has multiple partners. The speculum is inserted in the vagina. It is opened so that the cervix can be seen. Then a brush is used through the speculum to get a sample of cells from the cervix. There are signs and symptoms of cervical cancer, but one would not want to wait until we have signs and symptoms, because cervical cancer can be detected long before there are any signs and symptoms, because they are well-defined precancerous disease. And these precancerous diseases are usually mild, moderate, or severe, and they can be picked up by using pap smears long before cancer comes along. However, when there is cancer, the main symptoms are abnormal discharge, bleeding, and then if it is advanced and getting near to terminal, then people might start to get pain and invasion into the bladder, and the rectum get affected. But this is advanced cancer. Cervical cancer is one of those that can be prevented, and so screening can prevent cervical cancer by doing pap smears. And more recently, pap smears are being combined with tests such as tests for the human papillomavirus, like HPV DNA testing. And this could go a far way. I can tell you that women who do regular screening hardly ever develop cervical cancer, because the precancerous disease will manifest itself and prevent progression to cancer. What I would tell women who are reluctant to do the pap smear is they should get themselves screened. And by screening, we mean doing a pap smear on a regular basis. What do we call regular? The traditional recommendation is that the pap smear should be done annually. However, if one has had normal annual smears, it is quite acceptable to do pap smears about once every 3 years. As a matter of fact, if you do pap smear once every 3 years, better than not doing any pap smear at all.
For men, hearing the words prostate cancer is frightening, not only because it's a killer, but the side effects of surviving it and facing incontinence and erectile dysfunction is equally scary.
Prostate cancer is quite common, as we know, in Jamaica, where 91% of our people are of African ethnicity. It's the commonest cancer that we see. Certainly it's the commonest cancer and also the leading cause of cancer-related deaths. And this has been so for many years, so it's something that is a major issue here. It is thought to possibly be due to a genetic factor, and there are certain genes that have been discovered and associated with prostate cancer, and certainly more common in African American men or Afro-Caribbean men. And so if you look at a black man compared to another racial group, whether it be a white man or an Asian man, stage for stage, meaning that they present with the same disease characteristics, overall, the black man does worse in terms of their prognosis, in terms of aggressiveness, in terms of overall survival and outcome. So that would make sense to suggest that just definitely this is a more biologically aggressive disease. But we have to consider other social factors. Certainly black men present much later than their other social counterparts.
Yeah, we want to start him at about 3 o'clock, you know, so that's like a couple of minutes from now.
The diagnosis alone of prostate cancer may impact erections in the fact that psychologically a man may develop anxiety once he's told that he has a potentially life-threatening illness such as prostate cancer. So from a psychogenic point of view, yes, it may affect his erections. From a physical or organic standpoint, just the diagnosis of prostate cancer alone usually does not affect erections. However, as we know, some of the treatments may affect erections. Testing, which we also call screening, is trying to detect the disease at an early stage where it can be cured and prolong life. So testing involves doing a digital rectal exam where a finger is placed in the rectum to feel the prostate, and we assess the size and we assess the consistency, as well as doing a blood test which checks for a protein, and this protein is called a PSA. It's prostate specific antigen. It's a substance that is normally released by the prostate, but it released in high amounts in prostate cancer. So every year, starting at age 40, a man should do both his rectal exam, also called the DRE, and he should also do his blood test called the PSA.
Yes, 4.8 is not so bad.
So knowledge is power, and we know that. And so the first thing that we need to do is to make sure the information is out there to everyone, not just the men, but to their spouses, to their children, that this disease is a major killer in our country. It's a leading cause of cancer-related deaths, and that black men are high risk. Certainly, men should also be aware that if there is a family history of prostate cancer, their individual risk increases. The other thing we need to do is to demystify all of these things that have been said in the past about things related to prostate cancer, the myths and so on, and just be honest with patients and let them know what the issues may be related to diagnosis, what the risk factors are like, and what the potential complications are, but still, you know, empower them in the sense that they will know that they should present and present early.
Making healthy diet and lifestyle choices will not only benefit your overall health, but it will also lower your chances of developing prostate conditions, including prostate cancer. Maintaining a healthy prostate means maintaining normal urination and, very importantly, normal sexual functioning. Simple lifestyle changes can decrease your risk as a man of developing prostate cancer, which is the second most common cancer in men. So what are these lifestyle changes? Well, let's start with your diet. You should eat moderately in order to maintain a healthy body weight. Being overweight or obese may affect your hormone levels, causing you to be more likely to develop prostate cancer. You should eat a low-fat diet that includes a variety of fruits and vegetables, whole grains, and fish, especially those rich in omega-3 fatty acids like salmon, tuna, and mackerel. And stay away from those fatty foods, sweets, and salt. Do not have more than 2 drinks of alcohol per day. Heavy drinking increases your risk of getting prostate cancer. Exercise. Exercising 4 to 5 times per week for 30 minutes per day helps to keep you at your right weight, keeps your weight under control. And finally, if you are a man over 40 years old, get a yearly physical exam. This exam should include a prostate exam, the PSA blood test, and the rectal examination should be done. You've heard so many great ways to help you stay healthy and keep physically, emotionally, and mentally fit. Now is the time to start applying these healthy living recommendations to your life. When you do so, you will become your healthiest you.
We've gone through several subjects our first season. Now we want your help. What are some of the health topics you'd like to see in season 2?
I would love to see you hear pre-eclampsia in season 2 because it's a silent killer for mostly first-time moms.
Persons who have been affected by breast cancer, and I would like the nation to be more aware of it.
Discuss about the eye, in particular cataract.
For me, I have asthma, and eczema. So how to treat eczema, because it's something that I just found out I have, would be beneficial for me and I'm sure other persons as well.
Varicose vein, and what are the things that can be done towards it.
Persons to be more informed about fibroids.
Alopecia, where guys and females losing their hair.
And I don't know really the name for it, but I don't know if it's bone cancer, but I would love to see that it's a
female problem, yeast infection.
I would like to see more about our cardiovascular disease and hypertension.
Everywhere I go, I see people bleaching. So I'd like to know what it does to persons.
A lot of persons ignore care of the mouth, which is vital for communication relating to people, our smile all. We need oral hygiene for the next season.
Thanks, we'll look into those, and thank you for watching all season. I also have to thank my unofficial co-host, Dr. Karen Griffith-Padlin, who answered all your questions this season.
And to our sponsors UNFPA for their support in making it possible to bring this show to you, and the fabulous locations for allowing us to film this season.
Most important, I'd like to thank you, our viewers, the production team, and I enjoyed every minute of making you your healthiest you. As usual, I'm Amashika. Come on, guys. Until next season, stay healthy!
Yeah, with the powder.
Healthy.
Yeah, that's nice.
Accommodation provided by Sunset Beach Resort and Spa. Hairstyle was provided by Just Natural Hair Studio. Bring your roots to life. And outfit by Sandy's Selections. Brought to you by UNFPA.